Hello, dental online trainers, and welcome to the Dental Online Training Sharecast. I am your host, Dr. Dennis Hartlieb. Each month, I'll be talking with dental experts who are doing amazing work in the world of dentistry and talk about how they got there, where they are today, and their influences and their journey in the world of dentistry. And as a bonus, I'll occasionally throw in a few of my solo bonding sharecasts, where I share a little with you about what's going on in my practice and lessons that I have learned along the way during my career. So tune in every other week to hear our latest episode.
Hey listeners, we had a little technical difficulty with the audio quality in this episode, but we still wanted to share this interview. If you have a hard time listening, be sure to check out the complete transcript linked in the show notes so you can read the valuable insight from Dr. Margeas. With that being said, let's get into this week's interview.
Hello, dental online trainers. It's Dr. Dennis Hartlieb back with another wonderful episode of our Sharecast with a dear friend of mine, someone I've known for most of my professional career, a great dentist, Dr. Bob Margeas. Bob is a graduate of the University of Iowa. He's a Hawkeye from 1986, I believe, and then he did a AEGD residency program afterwards. Bob is, if you don't know Bob, it's time to crawl out of that rock that you're hiding underneath because Bob's everywhere. He really is, I think, really the face of our contemporary dentistry for a good reason. Bob's one of the hardest working individuals in dentistry that I've known over my career. The most humble person I can tell you that I've met over my career in dentistry over the 30 plus years. He has tons of accolades. He is a member of the American Academy of Restorative Dentistry, the American Academy of Aesthetic Dentistry. He is, I think, a fellow of the Operative Dentistry or Master of Operative Dentistry. And he is publisher for a number of journals that we'll talk about in just a little bit. But he keeps his nose to the grindstone. He's an incredible practitioner, incredible lecturer, and just a dear friend. So without further ado, Bob Margeas, welcome to our Sharecast.
Thank you, Dennis. We're finally getting it done. We've been trying to get this done now, and we found some time to do it. And in honor of you, go Blue!
There we go. So celebrating Michigan's national championship in football for all you Buckeyes out there, eat it. And all you cheating scandal people, I don't want to hear about it. It was great. So if you're not a football fan, you're just going to have to deal with me just gloating for a couple seconds here while just reveling in our wonderful victory over Washington Huskies just a couple nights ago. Bob, thank you for supporting the Michigan. His stepson goes to the University of Michigan, and so he's now drinking the maize and blue Kool-Aid. So we're just glad to have you on the party bus.
So being a Hawkeye all my life, when Nick started at Ross, I decided, you know what, I'm going to have to be a Blue fan. So I am maize and blue. Maize and
blue. Yeah, there we go. So it's good to have you on board.
Thank you so much. Thanks for the comments.
And 100%. Truth and from the heart. So I met Bob. So many of you know that I was partnered with Dr. Buddy Mopper, who started Cosmetic decades ago. And Buddy and Cosmetic started a teaching center in downtown Chicago. And early on, when the teaching center was first built, I was down there taking a look at the teaching center and visiting, and in should walk this fella who was about my age. My years of experience, a little more bald than I was, sort of a glistening head. And in walks Bob Margeas and introduces himself and was just so open and was just generous with his time and was just so welcoming when I first met Bob. I don't know, do you remember that day, Bob, when we met at Cosmetic?
I sure do remember it.
Yeah,
over 25 years. It was 25 years ago.
It was 25 years ago. Yeah, we were both young dentists back then. Remember that?
Both learning from the master.
We were both learning from the master. That's exactly right, Dr. Buddy Mopper.
Yeah.
So, Bob, fill in the blinks. What did I not fill in with your background? So, University of Iowa for dental school. Where did you go for your undergraduate?
I went 2 years to Iowa State. I was a Cyclone for a couple of years. And then I ended up going to Iowa for one. And I I was fortunate to be able to be accepted to Iowa after 3 years. So my freshman year counted as my senior year, so I could get done in 7 versus 8. And so that's how I decided to attend the University of Iowa.
Yeah, I did the same. Looking back at it, I don't know what I was thinking. I think I missed out of, I still have a year of eligibility and I'm trying to get on the Michigan team. So I don't know, but it was, I think sometimes rushing through undergrad. I mean, it was great. So grateful to get into dental school, but looking back at it, sometimes you got to think about what's a rush. Now, neither of your parents are dentists. You don't come from a family of
Nope.
dentists. So talk about your background.
Yeah.
What'd your parents do? And I want to know
Yeah.
about why dentistry.
Yeah. That's a great. Uh, my parents were in the restaurant business. Being Greek and all. My grandfather came from Greece, opened up a Coney Island back in 1918, and my father and his brother worked in the shop. Ended up opening a couple of their own restaurants, and I have a twin brother that went into business, and want to do restaurant. I saw how hard we were working from the time we were 12 till about 18. And when I went off to college, I knew that I just didn't want to be in the restaurant business. It's a good business, but you got to be there.
It's a hard business. The only thing I've done besides dentistry is
Gosh.
restaurant work, and
Yep.
restaurant work is, I mean, I loved it. I love the service aspect of it, but man, it is hard, hard work.
It really is. And so I decided that I was going to do something different. So I was a biology major at Iowa State. And after a couple of years, I was thinking about medicine. I wasn't sure what I was going to do. I didn't know for sure what, career path I wanted, but I wanted to go into the like health field section. And after 2 years at Iowa State, my roommate was transferring to Iowa to go into medicine. I thought, well, maybe I should be at Iowa. It's more of Iowa State's more engineering, so I went over there. And while I was over there, one of my other fraternity brothers was in dental school, started in dental school, and so he says, "You ought to come over to dental school. I want to be a dentist."
Do I know
Well,
these? Do I know this fraternity brother of
uh,
yours?
I don't think you would know him. His name's Dennis Winter. Dennis
Okay.
Winter is his name, and he was going to dental school and says, "You ought to come over to the dental school. See, maybe you like this." So I went over there and I thought, "Wow, this is kind of interesting. This is neat." And he said, "Well, they're the DAT. You ought to sign up for the DAT." And I didn't know much about it, and so I had contacted the school and up the DAT, and they said, "Well, you're a little bit late, but if you show up for the day of the DAT, if someone doesn't show up, we'll let you take the test." And so I showed up at that time, and somebody didn't show up. A few people didn't show up, so I started taking the test. So I took the test. I did okay, and that was the year that I was going to be in the Rose Bowl, and it was December. Applications for early were due like December, and they were picking the class, this and that. And I decided to drive out to the Rose Bowl, so I didn't even get my app in really. And when I got back from the Rose Bowl in January, I sent my application in, Dennis,
All right.
and so I
Did you
waited
did
and
you put on your application like, sorry, it's a little late. I was busy watching the Hawkeyes at the Rose Bowl.
yeah, I didn't say that, but I probably could have said that because I had an interview at the university. They gave me an interview, and unfortunately, I was waitlisted, and they said, you're not accepted to class, but you're waitlisted, and because you're only a junior in the summer, you're going to have to qualify to be admitted. If you get admitted, you've got to take physics lab. So I had to take like 6 hours, like in the summer, to have the ability to be admitted. So now this is. I went to the administrator's office and said, "Hey, I don't know if I really want to work that this summer if I don't have a chance of getting into dental school." And she says to me, her name was Janet Crow. She says to me, "I can't what number you are on the wait list, but my recommendation would be that you take summer school." And so here I am taking summer school, and July comes around, August comes around. I had not heard. Well, school was
Wow.
starting like August 23rd. Well, one started dentist, I get the letter. It says you're accepted to dental school.
That's crazy. So had you signed up
It's
then for classes for fall
I
at
had
Iowa for your senior
yeah
year?
yeah I planned it on senior year taking classes, and um, all of a sudden the letter comes to Sioux City, Iowa, where I was after summer. I got in. I guess I'm going to be a dentist. Dentist. I never grew up thinking I was going to be a dentist. And I will be honest with you, if I did not get in that year, I may not have applied again. And I'm not
Isn't
even
that
kidding
crazy?
you. Yeah,
It's
because it wasn't like I desired to be a dentist. I really never grew up thinking I was going to be a dentist.
I think it's so interesting. All these sharecasts, it's such a range of people, people like myself that knew they want to be a dentist when they were kids, to people who, in for whatever influence it was someone that they knew, it was a friend, it was someone some contact that said, "Hey, why don't you look at dentistry?" And then next thing you know, they become a dentist and they become a one of our leaders in dentistry. It's such a crazy, you hear Frank Spear's story of being dragged to the counselor's office and it's just one after the next. I think it's so interesting how people end in dentistry.
It is. And I just can't imagine my life not being a dentist
Right? Yeah.
and not growing up wanting to be a dentist. And I will tell you, Dennis, that oh, was so cool and influential that when I was able to donate back to the school, I was given money. They go, "What do you want the money to go for?" I said, "I want to go to the Janet Crow Radiology Center." And so this was the best. I gave the money. They put the big plaque on, and I tell her, I said, "Because of you, I'm a dentist." Well, her mom was visiting her, and they walked around saw that, and her mom saw it because I don't think she had told her mother about it because she at that time was probably in her 60s. Her mom had to be 80s. She goes by the room, and her mom just like stopped and was like so happy, and it brought a warm feeling to me when Janet wrote me a letter and told me the story about it. Made it
That's awesome.
so nice. It was
That's
really
so
great.
cool. That's what it's all
Yeah.
about. That's so cool. I bet your
Yep.
parents must have just. So, what was their reaction when you decided to become a dentist? I mean, I can imagine my parents were both sort of blue collar, came from blue collar family and stuff like that, and I think they were, so proud and very, just very proud of me going into the profession and stuff. What was it like for your folks?
Yeah. Nobody had gone into medical or dental profession. Everybody was, my sister was interior design. My other went into business, and nobody went into the family restaurant until my brother did. And so they were really proud, like, "Oh, we're going to have a dentist in the family," and blah, blah, blah. And I will tell you that when we grew up, we were middle class. I mean, my dad had a hot dogs restaurant, the Coney Island, but he always made ends meet. And my mom always said to me, "When you become a dentist," she says, "you need to remember the people that need the work because Dr. Barnes, our family dentist, he was one of the last ones to get paid because we didn't have our money. And he let us have a payment plan."
Yeah.
And so I always remembered my mom saying that. And
Yeah.
so I'm a little bit lenient as far as that goes, and we do, maybe we don't get paid for, but it's fun. And
Yeah.
and my mom being a kind of a spiritual person would always say, "God, in the hands to do this, you have to take care of the people." And I do believe, like you, Dennis, I know you, that when you're not motivated by money, if you just do the right thing, you're going to be successful.
Yeah. I
You're going to be
agree.
successful.
You start out at Iowa Dental School. What was it like when you
Yep.
first walked into the school? Do you have any memories, your first
Yeah,
days at the school?
I sure do. Uh, Going into the school, it was started in '84. It was a new school before I started in '82. So it was a modern school. And the thing about Iowa was, you to the clinics right away. And so freshman year, you at the end of your freshman year, you were doing like trophies and doing
Oh,
scaling and root plan. And then
that's
at the
great.
beginning of your sophomore year, you actually did operative dentistry.
Wow. Yeah,
It
like a
was
year
your
ahead of most
sophomore year.
schools.
Yep, we were. And I still remember we started operative as sophomores. And I remember my first patient was the distal lingual groove on number 14. And I was very nervous, and I open it up, and it's got some of that leathery decay, and I'm very timid. And my first dental assistant,
It looks like
Taylor
it looks like
World.
you're already in the Pope when you see that, right?
Exactly right. And Taylor goes, "Come on, just clean that out. That's decay. The nerve's not right there." And so I cleaned it out. I did the restoration, and Taylor was, really guiding me. Great student. Fast forward 25 years, I'm at Utah State Dental Association, and I knew Taylor was practicing in Utah. And I said to the guy who introduced me, I said, "Is there a guy named Taylor World that is a member here?" He goes, "Yeah, in fact, he's in the back over there." And I saw him and I recognized him, but he was kind of looking at me like he wanted to come up and talk to me, but I was avoiding him because I wanted to share the story of Taylor. So when I started, I wanted to thank everybody. I said, and it's a special treat because I have my first dental assistant here in the audience, and I'm sure people thought it was like a female or something.
Right.
I said, and his name is Taylor World. He's in the back right there, and his smile. And we ended up hooking up for lunch and talking. I told the story about how he was my dental assistant, and it was just a gas. It's so much fun. Dentistry's been just a fun career.
That's awesome. That's a great story.
Yeah. Yeah.
Uh, when you're going through dental school, I mean, we all have different experiences. And I think back in the 80s and certainly before then, dental school was different then than I think it is now, at least the way people educate, the way we people communicate. How was it going through Iowa? What was your undergrad experience like with the dental school?
The dental school was great. I felt we got a great education. And I feel like education today, because I still teach, I've been teaching there now since 1990. The education has changed. When we went through dental school, it was mainly porcelain fused to metal and gold and amalgam.
Mm-hmm.
Yeah. And now today, what we have to teach is so many different materials, so many different techniques, now scanning and implants, that there's not as much time really to incorporate all of that, with dentures, partials. Iowa was very, very clinically oriented. And the way that they did it was after your sophomore year, your junior year, you would go through blocks, and you would have maybe 6 weeks in pedo, 6 weeks in operative, or 8 weeks. And then you'd go into removable pros and then fixed pros. And then you'd have a block of endo. Then you'd have oral surgery. So all those were subspecialties. You would just spend time in it. And then your senior year in family dentistry is when they put it all together, where you did comprehensive treatment and you could do what you wanted to do. And so Iowa back then was all really, really clinically oriented. One of the top schools all the time. I still think it's a good school. It's a very big research-based school.
Mm-hmm.
Dow's research and stuff like that. Was it fun? It was difficult. I had a difficult time in dentistry. It wasn't a cakewalk for me.
Yeah, same. I say for us back then, we had to learn an inch of material a mile deep. Today, students have to learn a mile material, but they can only learn it an inch deep because there's so much they need to learn. Materials are changing so frequently, and I think for us, I think we had the advantage that we had multiple reps doing the same procedures over and over and over. So I think we had a fair amount of confidence coming out of school. I think it's difficult for students today because they get so few reps because there's so many different techniques, so many different materials that they got to become familiar with. I think it's way more challenging for students today than when we were, in the fact of the amount of information that they have to learn. But that's sort of, I think, the nature of practice as well. I mean, dentistry is just so accelerated that every year there's new materials, and I want to talk about that in a few minutes because I know you're really on top of all that stuff. But I think that's a real challenge for students today, and I don't envy them. I think it's tough to get on top of all that stuff.
No, and listen, I hired a dentist right out of dental school. With all my experience in doing these people, all my buddies were like, "Man, why are you hiring somebody right out of dental school?" Well, he was a patient of mine since the time he was 3 years old, and he has a great personality, great work ethic. But I will tell you that he has done 0 dentures in my practice. He hasn't done maybe 1 partial. They never did cast gold. They never learned cast gold in dental school.
No. Mm-mm.
And I think it's kind of a shame because some of those techniques, I mean, if you can't do a denture, how are you supposed to do an all-on X?
For sure.
You need to understand occlusion by doing dentures. That's where
Yeah.
we learned occlusion.
Smile
And
design.
so
We
I
learned
think,
smile design with
yeah,
doing dentures.
exactly. And so I think they're a little bit behind the eight ball. And now that, some of the teaching institutes like Coyce and Spear and Pankey and stuff are now having to maybe teach some of the things that we learned
Yep.
more in dental school. But I learned when we didn't wear gloves.
Yeah.
We had just started wearing gloves maybe the next year. You remember that, Dennis?
So I graduated in 88, so I'm a couple years behind
Yep.
you. And so when we were in
Yep.
pre-clinic is when we started wearing gloves. And I remember my
Yep.
instructors losing their minds over having to wear gloves. Some of these guys have been practicing for 30, 40 years, and they just
Yeah.
couldn't get the idea that they were going to have to start wearing gloves. It was a very interesting time for sure in dentistry.
Absolutely. No doubt about that. And that's when the AIDS epidemic came out, which was scary for us.
And I think that's so interesting. I have my eye doctor. He said he's on the Illinois board for I always get ophthalmologists and optometrists ophthalmologist, right?
Yep.
He's on the board, and he said, we took the playbook when COVID hit. We took the playbook from dentistry for what you guys did during HIV, and that's just what we applied for when COVID hit. And for us, I mean, we made some subtle changes to what we were doing in our dental practice, but everything that we were doing for HIV, I think completely protected us for the stuff that was going on during COVID. We added air filtration, we did a couple other things, but we learned some valuable lessons back then that I think have sort of paid off for us still to this day with infection control
Yeah, I
stuff.
agree. Totally agree. We were way ahead of the curve there.
So when you're getting out of dental school, you decided to do a residency instead of jumping into private practice. What was that about?
I was going to join the Air Force. And I told my buddy, I said, hey, we should join the Air Force together. Yeah, we were both single. And he goes, okay, well, we're going to go meet with Captain Stepnitz. And he goes, I don't know if I want to go in the Air Force. I said, but you know what? It's free pizza. They had a Giordano's that was in Iowa City. I said, let's just go have some pizza.
Fair enough.
So we go in
Spoken
there.
like a true student. Free food.
That's exactly free food. I
And then you
remember
went
like
and
it was
visited the Dalai
yesterday.
Lamas so you can get some more free food.
That's right. And I remember like it was yesterday that we go and we meet with him and he says, oh, you guys are good students, this and that. And I said, well, I'd be interested in joining if I can get a GPR. But if I have to go in active and not have a GPR, then I'm not really interested. He goes, you can apply for one and, we'll see what can happen. Well, I applied, Dan applied. Neither one of us got the GPR in the Air Force, but Dan decided to go in the Air Force and he stayed 3 years in the Air Force. I decided not to go in the Air Force. And the director of the AEGD program said, hey, we would love to have you stay here and do the AEGD program. Well, I remember at that time, the pay was $16,000.
I made 17 in my residency.
Yeah, I made 16,000. I said, I'll take it. And so I stayed, and that was a great year. That was a fabulous AEGD residency because they'd let us do what we wanted to do. If you wanted to do endo, you could do more endo. You wanted to do surgery, you could do that. And it was a great transition year for me.
Did you find, for me, I did GPR because I felt like I needed more time connecting the pieces, understanding more the relationship between, restorative dentistry and ortho and perio and trying to get all that stuff sort of figured out how all that sort of linked together. My residency didn't help me with that because it was a GPR, so it was more hospital based, but it did feel good to get a lot more reps under, and Michigan is less clinical than like Iowa, Detroit, some of the other schools in the Midwest. And so I felt like I needed to get more reps in. What were you looking for? Why did you feel like you needed to do a residency? What was in it for you?
You know what? I felt like I was good. And from a clinical standpoint, I had done a lot of my requirements early, this and that, but didn't really have there was a dentist in Des Moines that I really thought about wanting to go with. And he wasn't really ready for me to be an associate because you ought to do something else for a year. Maybe perhaps it can work out that when you get done. He goes, I'm not guaranteeing anything, but do it. So I mainly did for the reps, like you said, and I wanted to get some of the directors were prosthodontists, and I wanted to learn more, some of the removable and comprehensive cases. So I got a lot more training, and at that time, porcelain veneers for me, Bob Nixon, who was one of my guys,
Yeah, so
got
that's
me going.
yeah, I wanted to talk about that because that's when you first saw Bob, right? Present. So for those who don't
Yep.
know, Bob Nixon was one of the pioneers in porcelain veneers. So Mark Friedman, Bob Nixon, there's several others, but Bob was really on the cutting edge. And so talk about how Bob came into your life. And for those who he's since passed, but he was really influential in sort of prep design and so many other concepts with porcelain veneers. So talk about that a little bit.
Yeah, so during my residency, I was still in my residency at that time, and the director of my residency said, continuing education is super important. Is there some courses that you want to take? Let me know. And the reason why I'm a member of the Chicago Dental Society, and I haven't missed a Chicago Midwinter meeting since 1986. I've gone every year since 1986, whether I spoke or was just a participant. Now, he sent us to the Midwinter, so that's why I went. But then Brown Dental Lab in Davenport, Iowa was having a Beverly Hills dentist, Bob Nixon, Dr. Robert L. Nixon, was putting on a veneer course. So he goes, I'm going to send you there to learn how to do veneers because nobody was doing porcelain veneers at the school at that time. And so me there to learn from Bob Nixon. And when I came back, the Center for Clinical Studies was doing some porcelain studies. Jerry Dennehy and Daniel Chan, and they were doing, and Mark Jensen, they were doing clinical studies on ceramics. And they said, "Hey, find a case, and we'll do some porcelain veneers." So I remember doing my first case in 1986, Dennis. I had never done a porcelain veneer case, and I ended up doing this case live
Oh
at
my
the
God.
live in front of 150 dentists.
Oh
And,
my.
and listen, I'm a recent grad, and let me tell you what. I'm in Cedar Rapids at the Five Seasons Center. They have a dental chair set up. The patient was a hygienist, and I had prepped the teeth already, and the veneers were made. Now I'm going to show them how to put the veneers on. So I tried the veneers on. All the veneers fit. I put them on the tray. My dental assistant puts the air water syringe on number 10 and breaks it.
God. Oh my God.
So I had never even done a temporary. We didn't temporize back then, Dennis. When we prepped, we didn't even use anesthetic. We
Oh
wanted
my
to know
God.
where
An
the enamel
enamel.
was.
Yeah,
Right.
Madden stayed enamel.
And when I
Oh my
remember what
God.
you said, Mark Friedman and Bob Nixon, they were the gurus, and their work today is standing the test of
Oh yeah,
time.
right.
Their their prep design, staying minimal prep and enamel. And people say, "Do you like minimal prep veneers or no prep veneers?" I said, "Well, I'm not a fan of prepless veneers, really. I'm a fan of prep less
Yes.
veneers,
Yeah.
not prepless." So I did those veneers live, and I ended up cutting them off a week later
Oh
at
my
the school
God.
because I didn't like them.
Oh, I
But I had to do it
bet.
live.
Oh
Yeah.
my God. I can't even imagine. I wouldn't do that today. I'm sorry. But
No,
no,
that,
nothing could convince me to try and do that. And with the bright lights and the light
oh
sensitivity
my
of our
gosh.
materials. Oh my God. I can't imagine the sweat pouring off my head, landing in the patient's face as I'm trying to do something like that. God bless you.
Yeah.
Boy, yes, that's
Yeah.
you got
That was my first start. Yeah.
some big kahunas there. That's a way to start out.
Well, I was too
Uh,
naive, probably.
well, yeah, you don't know what you don't know, right?
That's right. Yep.
So that sort of led you to your connection with Buddy Mopper, which is how
Yep.
I got together, right? So talk about sort of your relationship with Bob Nixon, how that sort of developed, and how,
Yep.
I think this is an interesting thing, Bob, because we've talked about this before. Um, Talk to me about how you connected with Bob Nixon, because I think it's important that other dentists hear this, because I think this is important if you want to. Um, if you want to connect with others and stuff. So
Yep.
talk a little bit about that.
Yeah. I'll talk about Bob first, then we'll get to Buddy next. But Bob Nixon, so I took this course with Bob Nixon, and Bob was a great teacher. Bob was a fantastic mentor. If you had questions, Bob Nixon was going to answer it. He's going to do the best he could. Bob obviously, was in Hills, worked with Da Vinci Dental Studios, and by trade, he was an endodontist and turned into being a cosmetic dentist. He started out as an endodontist for over 10 years in Delaware.
Yep.
And then moved on to be worked with Bob Ibsen at Denmat. He was one of the Denmat guys originally, and then he went to Da Vinci. But he took a liking to me. And so after that course, I kept in touch with him, and I would take more courses over the next few years. But that relationship led me to Buddy Mopper. And Bob Nixon had said, hey, there's a dentist, Buddy Mopper, who's close by you. He's doing composite resin. Well, Buddy Mopper comes to Iowa to lecture at the state dental meeting, and it was 1990. And I was out of school for 4 years. I had been doing some table clinics at the state meeting. And I remember my first table clinic was called Etched Porcelain Restorations. They Work. And it was 1987. And I had this board talking about maintaining the enamel and bonding them on it. And at that time, a lot of the prosthodontists were saying, you can't bond that stuff on. You got to use zinc phosphate cement and do crowns, because veneers were not really, mainstream at that time.
Yeah, I don't think people realize that porcelain veneers didn't come out until the late 80s and didn't become popularized till the mid 90s, maybe towards the end of the 90s. So when we started our career, I mean, porcelain veneers were not an option when I was starting. I didn't even know about porcelain veneers back then.
Yeah. Obviously the first was written by Calamita and Horn back in the early 80s, but nobody was really doing mainstream, like you said, until late 80s, 90s. Mm-hmm. And so, Polydorn, one of my mentors, he said, hey, you're doing these veneers. You ought to do a table clinic. So I did a table clinic at the and I got an honors clinic, so they invited me back the next year. Well, Buddy Mopper was lecturing, and I went up to Buddy Mopper and I said, hey, I'm Bob Margeas, and Bob Nixon had told me about you. I grew up in Sioux City. He goes, Sioux City? He says, I grew up in Correctionville, which was 18 miles from Sioux City. I don't even know if you know this story, Dennis.
No, I don't.
But he grew up in Correctionville, and he says to me, Sioux City, he goes, yeah, what do your parents do? I said, well, my parents run the Coney Island restaurants in Sioux City, Iowa. He goes, what? The Coney Island restaurants? He goes, when I would take my Hebrew lessons, he would take his Hebrew lessons. He'd drive the bus, get on a bus from Correctionville to Sioux City, and he would always stop at the Coney Island.
That's hilarious. That's crazy, right?
It's hilarious. Yes. So my grandfather, who he knew because he would go in there all the time, and my grandfather, he remembered my grandfather. My grandfather was tall, and he always had a toothpick in his mouth because he always smoked cigars, and he'd want to break the cigar, and he'd have a toothpick. Yeah. And Buddy would say, oh my God, I used to have the hot dogs all the time. Every week when I go, we'd stop at the Coney Island because it was a few blocks from the Jewish Community Center.
Right.
So Buddy took a liking to me. He was teaching classes and invited me to come to Chicago, to take some classes from him. So fast forward maybe after that, I think it was a year or two after that I took my first course from him on composites. And the center wasn't open, but they were teaching it in the basement.
Right.
401. It was like a room, and they had all the equipment there, and Corky was teaching with him. And so I was in his first class with Brian Vence. Vence and I, great dentists. We took Buddy's first course, and I remember taking the course. And Dennis, Buddy, he'd take a look at your model. You go, oh, come on, look at this lining, or look at this, or look at that. Nothing I did was any good.
Yeah.
And so I left there kind of a little bit dejected, but not really, because I had learned. But I ended up taking the course again about a year later when they were up in the actual teaching center. So I ended up taking Buddy's class twice. And then by then I was learning a little bit, and, Buddy was give people a little bit of a start, and, he took a liking to me.
I think that's important for when you're going through this. I think there's a sense, there can be a sense that you take a class once and that you learn everything you need to know and that you're ready to roll. And I've taken Buddy's class, I don't know how many times, Newton's class, Corky's classes. Uh, for me, I have to learn, I have to apply what I can, get some more feedback, take the course again, get some more feedback. And that's how I've built my skills, is just, being willing to hear the negative, and being able to take just one step at a time and try to get a little bit better each time. But I think there's a false sense that you can learn everything unless you're remarkable, but that's certainly not me. In learning, I think it takes time to be able to hear the information and then adapt the information and then be able to clinically be able to produce it. So have some thick skin, be open to getting criticism and welcome the criticism, and understand that I think it's important to rehear the information and redo these workshops. I think that's critical. Hey, dental online trainers, just to let you know, this is actually a two-part interview with Dr. Bob Margeas. If you enjoyed the first part of this conversation, then please join us in just a couple weeks for the second part of this interview to drop. Check us out on YouTube or wherever you get your favorite podcast. And again, thanks for listening. I'm Dr. Dennis Hartlieb, yours for better dentistry. Well, thanks so much for listening or viewing our Sharecast today. If you enjoy this and you want to get more information from Dental Online Training, then check us out at dothandson.com. That's one word, dothandson.com. Now, as a reminder, DOT has so many great opportunities for your learning. We have our Wind and Unwind webinars, where we engage real time with our speakers and our viewers. During these live webinars, we bring in leaders throughout the dental industry to help keep you up to date on materials, issues, and techniques that affect you and your practice. We also have our monthly morning coffee and donut mentorship sessions, where we review cases and issues with our participants and what's going on with their practices. We recently launched our DOT Study Club session, where our DOT members present treatment cases, we do lit reviews, and our members provide pearls they found in their practice to help us all bring greater treatment to our patients. Hey, if you love doing hands-on workshops, you're going to love our live virtual workshops, where our dental online trainers perform the same techniques that I'm doing with kits that we have shipped to them from the comfort of their own home or their office. DOT was the first to offer virtual hands-on learning, and our members just simply love these courses. And finally, we have an endless selection of our on-demand, pre-recorded hands-on technique courses to help you improve the clinical dentistry that you provide for your patients. So check us out on Instagram, YouTube, or wherever you get your podcasts at Dental Online Training. And you can follow me at Hartlieb DDS if you'd like to follow on Instagram. And hey, be sure to share this with your friends and colleagues who you think might benefit from this Sharecast. And if you don't mind, leave us a 5-star review if you enjoyed our conversations. This podcast is edited by Luna Clark and includes original music by Chris Peterson. Again, thank you for listening. I'm Dr. Dennis Hartlieb, yours for better dentistry.